Deputy Micheál Martin.
Thank you very much indeed. Taoiseach, by the end of this year, we could witness over 100,000 people having been on trolleys throughout the year. And so far, there's been over 10,000 people over 75 years of age waiting for more than 24 hours in our country's emergency departments. We've lost so far this year about 136,000 bed days through delayed discharges, and that's only in the first 10 months of the year. And we know the extraordinary impact this has on patients and on people, and indeed on mortality rates in our hospitals and worsening illnesses that people have as they present to emergency departments. And that's not to mention the huge problem in terms of people waiting for outpatient department appointments, over 500,000, 16,000 children waiting for more than a year, for example, for an appointment in the 3 Dublin hospitals alone. Yesterday we had 449 patients on trolleys. There's 508 patients on trolleys today. It also places enormous pressure on the staff of our emergency departments and on our hospitals. And a document published yesterday, linked to the papers this morning in the Irish Times, lessons to be learned from the winter crisis of 2017-2018. One of its most basic observations is the need to plan in advance and to have all winter plans completed by the end of July of 2018. We're now in November and we still haven't the winter plan announced. And what we've also learned through a leaked report via Martin Wall, who makes up for the absence of transparency within the government and the Department of Health on health issues by revealing confidential letters on a regular basis. But he revealed in a confidential letter from the department to the HSE that 50 million that was to be spent on beds last year, on additional beds, didn't get spent, but instead has been used to deal with the excessive spending of 2017. I think that's incredible, Taoiseach, and I think it strains government credibility on the health issue, and particularly in terms of emergency departments, to the very, very limit when it now emerges that despite all of the announcements, and we have a series of announcements from Minister Harris throughout the year that money would be made available for extra beds, extra capacity, we now learn that that money was diverted and was never spent on extra capacity, either in beds. We know from many sources, the most recent being the former HSE Director, Tony O'Brien, that the consultant crisis, the inability to recruit quality consultants now, the paucity of applicants for consultant posts is adding to that crisis. So the need for a winter plan is basic. It's to enable people to have time to build up both physical capacity in terms of beds and also recruitment of staff in terms of the hospitals. Now, that didn't happen last year. It came too late, and the money was not spent optimally, and as a result we had a crisis reaction which was very poor and quite disgraceful. We're now going to potentially have the same this year through a lack of planning. Can you explain to me, Taoiseach, why that extra 50 million that was allocated last year wasn't spent on additional beds and on additional capacity? And can you indicate to me when the plan for the forthcoming winter period is to be announced by the government?
Taoiseach, please.
Thanks very much, Deputy. First of all, I want to acknowledge that we have a long-standing problem now with overcrowding in our emergency departments, one that we've faced probably for 2 decades at this stage. And certainly speaking as a doctor and as a grandson, I don't want to see any citizens or patients spending prolonged amounts of time on trolleys waiting for hospital beds. There are 391, or at least there were 391 patients waiting on trolleys this morning at 8 a.m. For admission to a bed. That's an increase of about 28% on last year, but is actually much the same as it was 2 years ago. And most of those patients will be in beds by this evening. Of course, as is always the case, there's big variation from hospital to hospital. As few as 2 or 3 patients on trolleys in Portiuncula, in Mullingar, in Blanchardstown, as many as 36 in St Vincent's. And we see huge variation from hospital to hospital, notwithstanding the fact that the same issues and challenges arise in every hospital. And we see once again that the RCSI hospital group, which includes Beaumont and Drogheda and Blanchardstown and Cavan, is outperforming all of the other hospital groups. The numbers of patients on trolleys in that hospital group at a record low, if not a 10-year low, and that shows the extent to which this is about clinical leadership and management as much as it is about resources and other issues. To answer your question in relation to new beds, 240 new beds have been opened. That's 22 in St Vincent's, 29 in Drogheda, 17 in Limerick, 28 in Galway, 19 in Waterford, 20 in Beaumont, 23 in St James's, 24 in the Mater, 11 in Naas, 30 in Cork, CUH, and 14 in St Luke's and Kilkenny. It wasn't possible to spend all the money for lots of different reasons, but that's how a lot of the money was spent, opening 240 different beds. There are different reasons as to why beds can't be opened for different issues. A lot of us do planning, for example, but if you let me answer the question, I will. So that's the 240 that were opened. The ones that weren't opened yet include another 79 additional beds, and they will be opened. They are delayed, but they're planned for this quarter and the first quarter of 2019. That includes an additional 30-bed ward in Drogheda and a 40-bed modular ward block in South Tipperary, which had been anticipated to be open by now but is now under construction, and also 4 additional high-dependency beds in the Mater in Cork. In relation to the numbers of patients who are having to experience time on trolleys, I think it's important to point out that the official numbers show that the numbers of patients who've had to spend time on a trolley waiting for a bed has been down month on month, down in May, based on May compared to May of last year, down in June, down in July, down in August, down in September, and also down in October as well.
Thank you, Taoiseach. Deputy Martin, you have a minute now.
Taoiseach, the bottom line is that the small number of beds that were promised for 2018 were not simply delivered by the government. That modular unit in Clonmel has been promised for over 2 years now, maybe longer, and still hasn't been delivered. The Minister yesterday couldn't give specifics in terms of additional bed capacity for 2019. He used the phrase early in 2019. Now, to be fair to your predecessor, Enda Kenny, he gave a whole new meaning to the definition of early. And normally it meant, at the very earliest, the middle of the following year, if not the end of the following year. So forgive me for being somewhat sceptical when ministers talk about early next year. That invariably means the end of next year and sometimes drifts into early the following year. Problem is, Taoiseach, delivery and the absence of delivery. And too many people, and too many elderly people, are suffering far too much in our emergency departments because of the absence of planning. Now, the lessons that were supposed to be learned from last year was that winter plans were supposed to be concluded by the end of July. That again has not happened this year. We're facing into another winter crisis in our emergency departments with a chronic absence of any planning and therefore a lack of any confidence in the capacity of our health service to deal with the issues that will undoubtedly emerge in the coming months.
Taoiseach.
The facts are this, Deputy. When you were in government with the Green Party, you took a decision to reduce the number of hospital beds in the Irish healthcare system. You didn't do it because of austerity, you did it during the boom because you decided that there was going to be a shift to day care and primary care, and as a result of that you started decreasing the number of beds in our acute hospitals. We reversed that decision in 2014-2015 and we've been adding beds ever since. And I've listed for you exactly where the 240 extra beds that have been opened this year are located, and there are 79 more on the way end of this year and the early part of next year. So we're getting it done. We are delivering. We're putting the new beds in place. We're reversing your policy, which was to reduce the number of hospital beds in our acute system. But when it comes to winter planning, we've had a winter plan every winter for 10 or 15 years, and it hasn't worked. And it hasn't worked. So if the lesson around winter planning, is that the standard winter plan that we've had for 10 or 15 years of additional home health, additional home care, additional transition care, it hasn't worked. The last thing we need to do this year is to just have another winter plan that won't work just as it didn't any other year. So here's what's going to happen between the 22nd of December. Can Corley speak?
You may.
Between the 22nd of December this year and the 3rd of January next year, there are 12 days, 7 of those days will be Sunday, Saturday or a bank holiday. And what's been happening in our health service for 10 or 15 years is the hospital effectively closes down for 7 days out of 12. What we need to do is change.
Please.
We need to make sure, for the first time ever that during that period the radiology departments are open and are working full whack and the staff are there.
Time is up
that
now,
the labs
Taoiseach.
are
Thank
open
you.
and working full whack. That the consultants aren't on holidays in the first week of the year, particularly those who work in the emergency department and our medical consultants. That nurses aren't on leave in the first 2 weeks of January, because we need to make sure that every bed is open. That's the kind of winter
Thank you,
plan we
Taoiseach.
need,
Time
not
is
the
up.
type of one that we've had for years and years and years that doesn't work.
Thank you. Deputy, please. Deputy, please. Could